to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Jeffrey Osborne with Covenant Orthopedics. Thank you so much for being here. How are you this morning, Doctor?
I'm doing wonderful. Thank you for having me.
Oh, that's great to hear. We're delighted to have you here. Now, today we're talking about what to do when you or a loved one gets a sports-related injury. Now, this is pretty timely right now for me. My daughter is conditioning with her volleyball team. My son is on the gridiron at football camp and with his team. So, Dr. Osborne, what resources are available for the community to contact if someone in their family suffers a sports-related injury?
It's a good question. Covenant actually has a 7-day-a-week from 8 a.m. to 11 p.m. hotline that you can contact. The number's 99583-SPRT, obviously for sport, and you'll be connected immediately with one of our sports medicine physicians who can kind of guide you through the process of over the phone evaluating what happened and kind of determine if this is something that needs to go in the emergency room, if it's something that can just be managed conservatively initially. And then the other benefit of that is once you're in contact with us, we can kind of work on getting, the student or the athlete or the person with the injury plugged into our system and kind of expedite getting into the office to see one of us for further evaluation to kind of determine what the next steps need to be.
Oh, doctor, that definitely gives me as a mom peace of mind. I love to hear that. So tell us, doctor, you help people with sports-related injuries as well as pain with their joints. So what are some of the common sports services available at Covenant?
Covenant has a comprehensive sports medicine program ranging from treating things with non-surgical measures all the way through minimally invasive surgical procedures to help correct tendon or ligament injuries or cartilage damage. We employ non-operative sports medicine specialists who will focus on therapy and other management options to kind of help avoid surgery when possible. And then obviously in the instance where, unfortunately something does need surgery, we do minimally invasive approach to almost every joint, which involves utilizing small incisions and camera and other instrument technology to help try to solve the problem while causing as minimal damage as possible to help people get back as quickly as possible. And that can range from acute injuries on the football field where a knee gets injured and needs to get repaired or chronic overuse injuries for the middle-aged person who's in a heavy labor job and kind of has wear and tear and needs to try to get back to where they were because of a chronic injury.
Oh gosh, doctor, active folks as well as athletes love to get back on the field or back to their sports quickly, so that quick recovery is great. Believe it or not, doctor, back to school is right around the corner, so we need some tips as parents to help our kids stay safe going into the fall sports season.
Yeah, absolutely. Obviously there's kind of some of the straightforward things like appropriate warm-up before practice and getting good stretching in, taking adequate time to recover, getting good sleep at night. But one of the big things that I think probably isn't common knowledge would be something called heat exhaustion or heat stroke. It's a condition where the body loses its ability to regulate its internal temperature, and it can be a serious condition if it goes unnoticed. It's especially important kind of in the August months, as you alluded to, as kids are getting back out in the field, where high temperatures and high humidity kind of increase the risk for that. So it's, especially on those hot, humid days, it's important that our student athletes are getting plenty of time to hydrate, plenty of time to rest throughout the practice period. On those really hot days, try to avoid heavy-duty practicing during the peak heat and humidity hours. Yes. And maybe even practice without pads during those times. If an athlete starts showing signs of excessive cramping, fatigue, shortness of breath, confusion, anything along those lines, they should be immediately removed from practice. Try to take them into a shaded area, immediately hydrate them, and then can contact the sports medicine hotline. Versus if things seem a little more serious, obviously always contact the emergency services if something like that were to happen.
I love it that coaches are also there on top of it. My son is at camp right now at football, and every so often the coach kept saying, get some water, drink some water, let's stay hydrated. So they're up on that. I love that. Doctor, just to reiterate, if someone has a sports-related injury after normal business hours, can they call the Covenant Sports Medicine Hotline?
Absolutely. Okay. There'll be someone available up until 11 p.m. Every day of the week. So unless you're in a 2 a.m. recreational basketball league, we should have you covered for any injury that occurs after hours.
And doctor, anyone can call the Covenant Sports Medicine Hotline?
Absolutely.
Oh, great.
If you yourself is someone again, that's in the driveway playing basketball with your kids and you sprain your ankle or twist your knee and you want to kind of get some advice, that's totally fine. Or if you're a coach or an athletic trainer or a parent whose athlete or child has an injury and you want to call to get some advice on their behalf, we're happy to take calls from anyone.
Oh, we'd love to hear that. Thank you, doctor, for that info. Anything else that you'd like the viewers at home to know that we haven't covered, Dr. Osborne?
And we covered it pretty well. Just that, Covenant has a comprehensive sports medicine program. We're here for, patients of all ages with all types of injuries, with our kind of goal of helping people get back to their previous level of activity when they've lost that from an injury. So, by all means, if you're having any kind of issue or ailment or concerned about something, give us a call and we'll do what we can to kind of get you back on the field and back to your activities.
I love it. So stay hydrated and make sure you call Covenant if you ever get into a bind. Thank you so much, Dr. Osborne, for taking the time out of your busy schedule to be with us today. You gave us some very, very valuable information. Thank you.
Thank you for having me.
Of course. We are so delighted to have you. So if you'd like more information about today's topic, just head on over to the Hot Links page. That's on WNEM.com.